So today I will tell you about the course of a child after a bone marrow transplant. So what we need to know after the transplant, what all precautions a child should take, what all should be done after a bone marrow transplant. The first thing to follow the post-transplant is to take your medicines regularly as prescribed by your bone marrow transplant physician. The second thing is the risk of infections. So we advise children a lot of precaution to avoid a lot of things so that the risk of infections is low. We always advise them to take freshly cooked home meal foods, to avoid packed and stale meals, and also not to visit public places for initial few months post transplant. Third is hygiene. They should maintain a good hygiene post transplant because it also reduces the risk of infections in the post transplant course. Third thing which is post transplant to be known is the vaccination. A vaccination post transplant is very important because we should know that during the transplant the immunity is very low, and because of the chemotherapy that we receive during the transplant, the immunity goes further down. The body forgets about the previous vaccinations in the bone marrow transplant period. So about 6 months after the transplant, the child should start with re-vaccination schedule as prescribed by the transplant team.